The major drugs in mantle cell lymphoma are the BTK inhibitors, and there's emerging evidence of a number of these BTK inhibitors which are all highly active in mantle cell lymphoma. The main thing with those drugs is the earlier they're used, the better the outcome, the less toxicity you have, and so these drugs are being incorporated to earlier and earlier studies. The study we've got running in the UK now with over 100 patients in is looking at ibrutinib with rituximab compared to the standard of care, which is chemotherapy. So that's going to be a large study, and the idea is to see whether chemotherapy or chemo-free approaches are the same, or possibly that the chemo-free approaches are better. They'll certainly be better tolerated. The issue then is that all patients relapse, and what do you do after that? We've just seen a presentation on venetoclax after ibrutinib, which is another active oral agent which works extremely well. So it's how we use these drugs, how we combine them. And then the thing that's perhaps more interesting is combining a BTK inhibitor with one of these BCL2 inhibitors, the venetoclax. So there's a study running with my friend Steve, who's just stood over there, an Anglo-French study looking at that combination together with a monoclonal antibody. It looks highly active. So these are the things that are moving forward. There are lots of other very novel things in the pipeline. The idea is that they are looking, well, we are looking at what the resistance pathways are when people relapse, and then trying to target therapies that where they're likely to be active based on that preclinical data. So we'll see, it's a very exciting time. Lots of drugs, almost too many drugs to be able to do trials, so you have to decide where you want to focus the energy, but right now it's all about the BTK inhibitors.